What you eat today will determine how much your sciatica hurts tomorrow. Not because food causes sciatica, because food determines the inflammatory environment your sciatic nerve lives in around the clock. And most seniors with sciatica are making 7 specific eating mistakes every single day that keep that inflammatory environment at a level where the nerve stays sensitized, stays hypersensitive, and stays painful. Regardless of every other intervention they try, tonight I am naming all 7. Not to take away your enjoyment of food, not to put you on a complicated diet, but to show you 7 simple swaps that remove the inflammatory fuel from your daily eating and give your sciatic nerve the chance it has been waiting for to finally calm down. And real quick, if someone you know eats well but cannot understand why their sciatica never improves, pause right now and send this video to them. What they are about to hear might be happening in their kitchen every single day, and if you are not subscribed yet, hit that subscribe button right now. Every week, this channel brings you honest, practical information that most people never discover. Now let us get into all 7. My name is Dr. Michael Kent. 20 years working with seniors managing sciatica, and in those 20 years, the pattern I have seen most consistently in patients whose sciatica never fully resolves is this. They do everything right with their exercise, they take their supplements faithfully, they sleep in the right position, and they eat in ways that silently undo every bit of that progress 3 times a day without ever realizing it. Before I give you all 7 mistakes, let me tell you about a patient. Details changed to protect privacy. A senior in their mid-70s came to me after 18 months of treatment-resistant sciatica. Disciplined, consistent, walking every morning, taking supplements, doing everything recommended, pain stuck at a stubborn 5 out of 10 that refused to move. During a detailed consultation, I asked them to describe everything they ate in a typical day. Breakfast, cereal with milk and orange juice. Lunch, a sandwich with processed deli meat. Dinner, red meat with bread and butter. Evening, a glass of milk and biscuits. They looked at me proudly. They thought they were eating reasonably well. I counted 5 of the 7 mistakes I am about to describe in that single day of eating. Not in dramatic quantities, just in the normal daily pattern of a senior who had never been told that what they were eating was directly maintaining the inflammatory fire burning around their sciatic nerve every single hour. We made 7 specific changes, not a dramatic diet overhaul, 7 targeted swaps. 6 weeks later, their pain score was 2.5. Same supplements, same exercise, same everything else, different eating. Tonight, every single one of those 7 changes. Mistake 1. Too much sugar is the single most consistent inflammatory driver in the diet of most seniors with sciatica. Not just obvious sugar, sweets, cakes, soft drinks, hidden sugar. The sugar in breakfast cereals, in flavored yogurts, in sauces, in packaged breads, in the orange juice most seniors consider a healthy morning choice. Here is what sugar specifically does to your sciatic nerve. When blood sugar spikes, as it does after any significant sugar intake, the body produces a rapid insulin response. And that insulin response triggers a cascade of inflammatory signaling that produces elevated levels of the same cytokines, TNF-alpha, interleukin-6, that are found in the nerve root tissue of chronic sciatica patients. Every sugar spike adds a wave of inflammatory signaling directly to the environment surrounding your sciatic nerve. But there is a second mechanism that is even more damaging for long-term nerve health. When sugar molecules in the bloodstream attach to proteins, a process called glycation, they form compounds called advanced glycation end products, AGS. And AGS are directly toxic to peripheral nerve tissue. They damage the myelin sheath protecting nerve fibers. They impair nerve blood flow. And they activate inflammatory receptors, called RAGE receptors, in nerve tissue that amplify the pain signaling of an already sensitized sciatic nerve. The fix: not zero sugar, reduced sugar. Remove the obvious daily sources first. Replace sweetened cereal with eggs or Greek yogurt. Replace orange juice with water and lemon. Replace packaged sauces with homemade versions. These 3 swaps alone reduce the daily sugar load dramatically without making eating complicated or joyless. Mistake 2, processed meats. This is the mistake that surprises most seniors the most. Because processed meats, Deli meats, sausages, hot dogs, bacon, packaged ham feel like real food. They are protein. They are convenient. They are a staple of most seniors' lunch and breakfast routines. But here is what they contain that makes them specifically problematic for sciatica: nitrates and nitrites. The preservatives used in most processed meats are converted in the body into nitrosamines. Nitrosamines are directly neurotoxic compounds that generate oxidative stress in peripheral nerve tissue, the same oxidative stress that chronic inflammation produces around the sciatic nerve. Every serving of processed meat adds a dose of neurotoxic compounds to the bloodstream that reaches the nerve tissue and compounds the oxidative damage that inflammation is already causing. Now stay with me, because this next part changes how you think about your lunch. Processed meats also contain significantly elevated levels of arachidonic acid, the omega-6 fatty acid that the body converts into the prostaglandins and leukotrienes, maintaining sciatic nerve sensitization. Two mechanisms: nitrosamine-derived neurotoxicity and arachidonic acid-driven prostaglandin production, both from the same slice of packaged deli meat. The fix: replace processed meats with fresh protein sources. Fresh chicken, fresh fish, eggs, legumes, canned tuna in water. Convenient options that provide the same protein without the nitrates or the arachidonic acid load. Mistake 3: too much red meat. Now this one requires nuance. Red meat is not the enemy. It is a legitimate protein source with genuine nutritional value. But there is a specific reason why excessive red meat consumption is consistently problematic for sciatica patients, and it is the same arachidonic acid mechanism we just discussed with processed meats. Red meat, particularly conventional grain-fed beef and lamb, contains significantly higher concentrations of arachidonic acid than plant proteins, fish, or poultry. And arachidonic acid is the direct precursor to the prostaglandin E2 and leukotriene B4 that maintain sciatic nerve sensitization. Every meal dominated by red meat adds a substantial dose of arachidonic acid to the bloodstream, providing the raw material for more prostaglandin production in the nerve tissue environment. This does not mean eliminating red meat, it means reducing the frequency. 2 to 3 servings per week maximum, rather than daily, and choosing grass-fed beef when possible because grass-fed beef has a significantly better omega-6 to omega-3 ratio than grain-fed. Replace the other meat meals with salmon, sardines, mackerel, or plant protein, sources that provide omega-3 fatty acids that directly counter the arachidonic acid inflammatory cascade rather than feeding it. Mistake 4: eating gluten daily. Here is the mistake that generates the most debate. And here is the honest answer about gluten and sciatica, specifically for seniors over 60. Gluten is not problematic for everyone. But here is what the research shows for adults with chronic inflammatory conditions including sciatica. Gluten, specifically the gliadin protein in wheat, triggers the release of a protein called zonulin in the intestinal lining of a significant proportion of adults. Zonulin increases intestinal permeability. It opens the tight junctions of the gut lining and allows inflammatory compounds into the bloodstream. The same leaky gut mechanism that this channel has discussed in the context of gut-driven sciatic nerve inflammation. For seniors whose sciatica has a significant gut-driven inflammatory component, which research suggests is common in treatment-resistant cases, daily gluten consumption from bread, pasta, pastries, and packaged foods is continuously triggering the zonulin response that keeps the gut lining permeable and the inflammatory pipeline from gut to sciatic nerve flowing. The fix is not a strict gluten-free diet for everyone. It is a 2-week trial of significantly reduced gluten consumption. Replacing daily bread and pasta with rice, potatoes, oats, and gluten-free alternatives, and honestly assessing whether the sciatic pain changes. Many seniors who try this are genuinely surprised by what happens in weeks 2 and 3. Mistake 5: too much dairy. Full-fat conventional dairy, milk, cheese, butter, cream, contains 2 specific compounds that are consistently problematic for sciatica patients. First, saturated fatty acids that directly activate TLR4 receptors on immune cells, the same receptor that bacterial endotoxins activate, triggering an inflammatory response in multiple tissue types, including nerve tissue. Second, conventional dairy's high concentration of arachidonic acid, adding to the prostaglandin production load that mistakes 2 and 3 have already been building. This does not mean eliminating dairy completely. It means reducing the quantity and choosing better forms. Replace full-fat conventional milk with unsweetened almond milk or oat milk for daily use. Replace butter with extra virgin olive oil for cooking. Keep some high-quality dairy, particularly fermented dairy like Greek yogurt and kefir, which have different inflammatory profiles than unfermented dairy, but reduce the daily total load significantly. Mistake 6, eating too fast. Now here is the one that nobody talks about. The one that has nothing to do with what you eat and everything to do with how you eat it, and the one that produces one of the most direct and most immediate connections between mealtime behavior and sciatic nerve inflammation. When you eat too fast, when you rush through meals, eat while distracted, barely chewing before swallowing, your body interprets the eating experience as a stress event. The vagus nerve, which connects the brain to the digestive system, does not receive the normal sequence of satiety and digestive signals that slow mindful eating generates. The body responds by activating a mild stress response, elevating cortisol slightly, increasing sympathetic nervous system tone, reducing the parasympathetic digestive state that allows proper nutrient absorption. This cortisol elevation from fast eating, repeated 3 times daily, adds a consistent low-level cortisol burden to the HPA axis that directly amplifies the inflammatory environment around the sciatic nerve. Research published in the journal Psychosomatic Medicine found that eating speed was directly associated with post-meal cortisol levels, with faster eating producing significantly higher cortisol responses than slow, mindful eating of identical food. For a sciatic nerve whose inflammatory environment is already cortisol sensitive, 3 rushed meals per day is 3 additional cortisol inputs every single day. The fix is the simplest on this entire list. Put your fork or spoon down between every bite. Chew each bite 20 times before swallowing. Take 3 slow breaths before starting each meal. These 3 habits slow the eating pace, activate the parasympathetic state, and eliminate the cortisol spike that fast eating generates. No dietary change required, just a different relationship with the speed of eating. Mistake 7, not drinking enough water with meals. The final mistake is also the most overlooked, and for the sciatic nerve specifically, it is one of the most mechanically direct dietary influences available. Your intervertebral discs, the cushions between each vertebra and your lumbar spine, are approximately 80% water. They maintain their height and their shock-absorbing capacity through their water content. When you are chronically underhydrated, the discs lose height progressively, reducing the spaces through which sciatic nerve roots exit the spine and directly increasing nerve root compression. Most seniors are chronically mildly dehydrated throughout the day, not severely dehydrated, mildly, chronically. And the time when hydration is most neglected is during and after meals, when most seniors drink little or nothing because they are focused on the food. Research published in the journal Spine confirmed that intervertebral disc hydration was directly associated with the degree of lumbar nerve root foraminal narrowing, with lower hydration status producing measurably smaller foraminal spaces and greater nerve root compression potential. The fix: drink 1 full glass of water before every meal. Not during the meal, before it. This pre-meal hydration habit ensures consistent daily fluid intake that supports disc height maintenance and reduces the mechanical nerve root compression that chronic mild dehydration progressively creates. 1 glass before each of your 3 daily meals every single day, 7 mistakes, all of them fixable. None of them requiring a dramatic diet change. Sugar reduced, processed meats replaced, red meat moderated, gluten tried without for 2 weeks. Dairy reduced, eating speed slowed, water before each meal. That is the complete eating protocol for sciatica patients, and it is the protocol that took the patient from our story from 5 to 2.5 in 6 weeks of consistent application. Your sciatic nerve does not live in isolation. It lives in the inflammatory environment that your daily eating either fuels or calms. 3 meals a day, 7 opportunities. Starting with your very next meal. Now before you go, drop a comment right now. Tell me your age and your city. And tell me, which of these 7 eating mistakes are you making every single day? I read every single comment personally. Share this with someone whose sciatica never improves despite doing everything else right. Subscribe and turn on notification because every week this channel brings you something equally specific and equally practical. 7 mistakes. 7 fixes. Starting with your very next meal. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Dietary changes should be made gradually. Consult your healthcare provider before making significant changes, especially if managing diabetes, kidney conditions, or taking medications affected by dietary changes. Dr. Michael Kent is a senior health educator with 20 years of experience. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.